Okay, let's unpack this. What if I told you that the seemingly local issue of stray animals in our communities is actually deeply intertwined with one of the biggest global health crises we're facing right now?
It sounds like quite a leap, doesn't it?
It does, but the scale of the problem you've highlighted in the sources is, well, it's alarming. Take India, for example. Over 3.7 million dog bite cases in 2024 alone.
And thousands of those resulting in rabies deaths each year.
Well,
It's a huge public health issue.
absolutely. And we're talking about an estimated 70 million stray dogs across the country. 70 million.
Yeah.
But what's really eye-opening here, I think, isn't just the immediate danger. It's how this neighborhood problem might be feeding into something much, much bigger, a global health crisis.
Right.
And that's the core of our deep dive today, really exploring these complex, maybe surprising links between stray animals and the rise of antimicrobial resistance.
And what's truly fascinating here is how this whole situation perfectly illustrates a concept we call One Health.
One Health.
Yeah, it's this understanding that the health of humans, animals, and our environment are all, well, completely linked. They depend on each other.
So you can't really treat one in isolation.
Exactly. It's not even a new idea, really. Its roots go way back to the 19th century. Rudolf Virchow talking about zoonosis diseases jumping between species.
Ah, okay.
Then later, Calvin Schwab spoke about one medicine, and then in 2004, the Manhattan Principles really cemented this need for disciplines to work together on disease.
So the main takeaway is you just can't fix human health problems without looking at the whole picture, the animals, the environment.
Precisely. You have to consider the entire ecosystem. It's all connected.
Right. So when we talk about these large stray dog populations, the immediate impact, it's obviously huge. Those bite statistics alone are shocking.
They are. And the data really does show a heavy burden on the most vulnerable.
Like children. You found that 20 to 40% of victims are kids.
Yes.
Yes.
Their smaller size, their curiosity, they're just more exposed, especially if they're playing near, say, garbage collection points where dogs might gather.
It's awful to think about.
And it's not just children. If we look at the bigger picture, the elderly are also incredibly vulnerable.
Slower reflexes, maybe frailer.
Exactly. Makes them easier targets. We found these really tragic reports. An 88-year-old woman in Pune trapped in her home, bitten repeatedly, or an elderly man in Aligarh mauled to death.
Oh, God.
These aren't just, unfortunate incidents. They fundamentally change how safe people feel, especially the most fragile in our communities. It limits their mobility, their independence.
And then there's the working poor. You pointed out they're a huge majority of the victims.
The significant majority, yes. Daily wage earners, delivery workers.
Well, like that terrible story about the Swiggy agent in Hyderabad who died trying to escape a dog.
Yes, exactly that kind of situation. Rickshaw pullers, sanitation workers, these are people often working outdoors, more exposed.
And the really devastating part you mentioned is that they might avoid going to the hospital after a bite.
Right, because losing even a day's wage is catastrophic, or the cost of the vaccine is just too high.
So they're caught in this terrible bind, public health risk versus economic survival.
It's a truly difficult position. And beyond the bites and rabies, which get most of the attention, there are other health threats too.
Like what?
Well, dogs can actually spread over 60 different diseases to humans. Zoonotic diseases.
60.
Wow. And things like dog feces. They can contribute to outbreaks of leptospirosis, Campylobacter, especially during monsoons when waste gets washed into water systems.
Because the dogs are just defecating openly everywhere.
And environmentally.
Yeah.
The sheer volume is staggering. Over 15,000 tons of dog poop and maybe 8 million gallons of pee daily on Indian roads and fields.
That's hard to even picture. That microbial load must be immense.
Exactly. Especially when it contaminates water sources. It's a major environmental hazard that often gets overlooked.
Okay, so we've got the immediate dangers, the bites, the fear, the environmental contamination, particularly hitting vulnerable groups hard. But the part that really struck me in the sources was this link to antimicrobial resistance, AMR. How does a local stray dog problem fuel such a massive global threat? It seems like such a jump.
Well, this is where that One Health idea really clicks into place. AMR, as you know, is when infections become incredibly hard, sometimes impossible, to treat because the drugs just stop working.
The antibiotics, the antifungal.
Right. They become ineffective. This leads to higher death rates, longer hospital stays, huge economic costs.
And what drives it?
It's largely driven by the overuse and misuse of antimicrobials, not just in people, but heavily in farming, in livestock, too.
Okay.
Plus, poor infection control, lack of clean water, poor sanitation, even just lack of awareness. It all contributes.
So where did the dogs fit in?
The close contact. Dogs, both pets and strays, living so closely with humans creates a perfect bridge for these multi-drug-resistant bacteria to jump between species.
They're literally sharing microbes with us.
They are. Their microbiome becomes part of our shared environment.
And there's actual evidence for this transmission.
Oh, definitely. The sources you provided show compelling data. For instance, pets sharing resistant bacteria with their owners. It highlights why we really need to include pet households in national AMR monitoring.
Right.
And then there are these findings from Argentina. Really interesting. They found higher levels of E. coli resistance in stray dogs compared to pets.
Okay.
But importantly, multi-resistant strains were found in both groups. And get this, ESBLs. Those are enzymes that make bacteria resistant to a whole load of common antibiotics.
Right. Extended spectrum beta-lactamases.
Exactly. They were confirmed in 22% of the stray dog samples they tested.
22%. That's nearly a quarter. That feels incredibly high.
It's very significant. It means a substantial portion of these strays could be carrying bacteria that are really, really difficult to treat.
So how far does this go? Are we talking just common bacteria or more unusual stuff too?
Well, that's the alarming part. Consider the discovery in Delhi, the first live culture of the drug-resistant yeast, Candida auris, found in the ear canals of stray dogs.
Candida auris. I've heard of that. Isn't that the one the WHO is really worried about? It is. They've flagged it as a critical priority fungal pathogen. It causes severe disease, spreads easily in hospitals, resists most common antifungals.
It can be deadly.
It can,
Hmm.
potentially killing up to a third of people who get a serious infection. And the really concerning thing, genomic analysis showed the strains in the dogs were similar to human strains.
Suggesting transmission is possible, or even likely.
It provides strong evidence for that link, yes. A potential transmission risk from animals roaming our streets.
That's genuinely chilling. So, if this fungus is in stray dogs, how does it actually spread to people? Is it just direct contact?
Primarily direct contact, yes, or contact with surfaces the dog has contaminated.
So a dog rubs against you, or sheds skin cells. Exactly. And in places with poor sanitation, or if people have cuts or wounds, the risk goes up. Because it's so resistant, once it infects someone, it's incredibly hard to treat.
A silent threat, really.
Very much so. And it's not just these more exotic fungi. We're also talking about resistance to really important classes of antibiotics.
Like which ones?
The sources point to the indiscriminate use of drugs, like cephalosporins and fluoroquinolones, which are critical in human medicine in animals.
And that's led to resistance.
Directly to resistant Enterococcus, Campylobacter, Salmonella E. coli, even MRSA. These resistant strains can then jump to humans.
MRSA from animals.
Yes. Pathogenic MRSA strains have emerged in livestock, causing things like mastitis in cows or skin infections in pigs and pets, and people working closely with these animals, or even just pet owners, can pick it up.
So, that friendly lick from your dog, maybe not so harmless.
Well, that's why Professor Nigel French from Massey University in New Zealand gives some very practical advice.
What does he say?
Basically, you shouldn't let your dog lick your face. If the dog licks your hands, you should wash your hands afterwards.
Simple hand hygiene.
Exactly. Basic hand hygiene and, maybe avoiding too intimate contact with your pet. It's a simple but crucial step for anyone, pet owner or not.
Okay, so this picture is pretty sobering. The scale of the stray issue, the immediate dangers, and now this insidious link to AMR, it feels overwhelming. What are we actually doing about it? Are current strategies working?
That's the critical question, isn't it? Let's look at the approaches. Historically, well, the methods were often brutal.
Culling.
Yes, things like electrocution, poisoning, clubbing, just horrific methods. But the evidence shows they just didn't work long term.
Why not? Seems counterintuitive.
Because if you only partially eliminate a population, you actually reduce competition for food and mates among the survivors.
Ah, so the remaining ones might actually breed more successfully.
Exactly, leading to a quick rebound in numbers. It is a gruesome and ultimately ineffective cycle.
Which brings us to India's animal birth control rules, the ABC rules, from 2001, updated in 2023.
Correct. These mandate capture, sterilize, vaccinate, and then release back into the same area. CNVR, basically.
But the sources you shared were quite critical of these rules, calling them fundamentally flawed and driven by animal rights over animal welfare. Can you explain that distinction?
Sure, it's a key point in the criticism.
Yeah.
Broadly speaking, an animal rights perspective often emphasizes an animal's right to live free from human interference.
Kind of hands off.
Sometimes, yes.
Yeah.
Whereas animal welfare focuses more on the humane treatment and well-being of animals within managed systems, considering their health, safety, and their impact on the surrounding community and environment.
Okay.
The argument in the sources is that the ABC rules, perhaps by focusing too much on the dog's right to roam freely without enough emphasis on managing the public health risks they pose, have inadvertently turned street dogs into a kind of state-maintained hazard.
Because the sterilization targets aren't being met?
Largely, yes. Despite huge amounts of money spent, the targets needed for population control, like sterilizing maybe 2/3 of the dogs in an area quickly, are very rarely achieved. So the population of 70 million remains largely unchecked.
And the feeding zones mentioned, they might actually make it worse.
Paradoxically, yes. While well-intentioned, they can sometimes concentrate dogs and support larger populations in specific areas without addressing the root causes or the public health aspects effectively.
And you also highlighted a huge gap, pet owner accountability in India.
A massive gap. There's no national law for mandatory registration, sterilization, or vaccination of pets.
Which leads to
Abandonment, adding directly to the stray numbers. And crucially, it means countless owned pets roam freely, breeding with strays, constantly fueling the problem. Without tackling responsible pet ownership, managing strays is like trying to bail out a boat with a huge hole in it.
It seems like a systemic failure. But are there places getting it right? You mentioned the Netherlands.
Yes, the Netherlands is a fascinating success story. By 2020, they effectively became the first country with no stray dogs.
Wow. How?
They took a really comprehensive, multi-pronged approach, a sort of One Health strategy in action. They had a strong CNVR program, yes, collect, neuter, vaccinate, return.
Similar to ABC, but maybe better implemented.
Better implemented, yes, but also crucially combined with other measures. Things like government-funded free sterilization for pets,
Okay, that's big.
and taxes on dogs bought from breeders or stores to discourage impulse buying, plus making adoption from shelters much cheaper and more attractive.
So hitting it from all angles, supply-demand responsibility.
Exactly. It wasn't just one magic bullet. It was a whole system designed to promote responsible ownership and control the population humanely and effectively.
That makes sense. And shifting back to AMR, are there similar comprehensive global strategies being employed?
There are major efforts underway, definitely framed within that One Health perspective. The WHO's GLASS system, the Global Antimicrobial Resistance Surveillance System launched in 2015, is vital.
What does that do?
It tracks AMR trends in humans, in the food chain, and in the environment, giving us a clearer picture where resistance is emerging and spreading.
Okay.
WHO also has its list of priority pathogens, bacteria, and fungi we urgently need new treatments for. And initiatives like GRDP, the Global Antibiotic Research and Development Partnership, are working to develop new antibiotics, aiming for 5 new treatments by 2025.
But development is one thing. Stopping resistance is another. Right?
Absolutely critical. And that means seriously restricting the use of important human antibiotics, like those cephalosporins and fluoroquinolones we mentioned, in animals. That link has to be managed much more tightly.
So bringing this all together,
Yeah.
it really hammers home that these crises strays, AMR, they're inseparable. And the solution has to be this integrated, multidisciplinary One Health approach.
That's the clear message from the sources, yes.
But putting that into practice, it sounds great in theory, but what are the real-world roadblocks? It must be incredibly difficult.
It is ambitious, and there's significant hurdles. Collaboration is a big one. Getting human health, animal health, environmental science sectors, all working together smoothly. It's tough. There are administrative barriers, different priorities, sometimes even different scientific languages.
Silos, basically.
Exactly. Silos. Then there are resource constraints. Especially in developing nations, you need stronger workforces, better research infrastructure, and funding agencies often still struggle to support truly interdisciplinary One Health research effectively.
And measuring success must be hard, too.
Very hard. Comparing different management strategies is difficult because studies use varied ways to measure success. There's often a lack of consistent reporting on, say, how intensively a program was implemented, the costs, sample sizes, making it hard to know what really works best.
So looking forward, what are the absolute key strategies we need to focus on?
Well, definitely improved global surveillance. We need a much clearer picture of AMR data, how antimicrobials are actually being used, and the underlying genetics of resistance.
Better data, better decisions.
Right. And rapid diagnostics are crucial. Faster, more accurate tests to ensure antibiotics are only used when truly necessary avoids unnecessary prescriptions.
Makes sense.
And finally, building a genuine global coalition, a political agenda for AMR. This isn't a problem one country or even one sector can solve alone. It needs coordinated international action.
So control the drugs, monitor the bugs, and work together.
Essentially, yes.
Yeah.
Strict, efficient control over antimicrobial use in both humans and animals, coupled with vigilant monitoring of resistance spreading in the environment, closing all those doors.
Wow. Well, as we wrap up this deep dive, it's just incredible how these seemingly separate issues, stray dogs in your neighborhood and this global shadow pandemic of AMR, are so profoundly linked through this one health lens.
It really forces you to see the connections, doesn't it?
It does. It's a powerful reminder that you can't just tackle one piece of the puzzle. Everything impacts everything else.
Yep. And perhaps it leaves us with a final thought, something for you, the listener, to really mull over. Given this complexity, these deep interconnections we've discussed, and seeing how piecemeal solutions often fall short, how can we, as a society, truly foster the kind of integrated, collaborative efforts needed across human, animal, and environmental health? How do we move beyond just surviving these crises to actually building optimal, sustainable health for everything on this planet?
Moving beyond just crisis management.
Exactly. And remember that stark line from one of the sources. A sterilized dog can still kill. It's not an argument against sterilization, not at all. But it's a powerful prompt, isn't it? To think much more holistically about what long-term, truly effective solutions actually look like. Solutions that consider every single part of this complex equation.